You're live.
Hi, I'm Patty Powell. I'm the founder and CEO of RestoreC. I am honored to be here today with Danielle, who is giving me, I'm so excited, a SaltFacial. I was exposed to SaltFacials through Dr. Emer, and I met Tracy, the CEO and founder of SaltFacial, who has been a huge fan of RestoreC. I am so grateful. And so what I wanted to be able to do is we were always talking about doing something together, but in order to figure that out, I needed to get a SaltFacial.
Okay, so hey guys, so we have Patty here, and that was an awesome intro. So we're doing her first SaltFacial ever, and as you guys know, we love SaltFacial, but why is it such a big staple in our practice? It's because SaltFacial is something that everybody can be using. It's safe for all skin types. It uses sea salt, which is natural and pure, to exfoliate the skin. So you're seeing improvement in acne and scarring and fine lines and all these textural changes that you normally see in the skin with something that is gentle, clean, and actually leaves you with really no downtime. So the other thing that's really cool, and the reason we're kind of starting to play with it, Patty wants to know what it did for her skin, what it felt like, because we use this SaltFacial as a method of preparing our skin for lasers, for peels, and for our skincare. Because when you remove that layer of damaged skin cells or that surface layer, you actually make it so that everything else you do penetrates and works a little bit better. So by removing this top layer of skin cells, all of the products that she goes and applies are gonna sink in a little bit better, be a little bit more effective, and you can adjust this treatment from being very light exfoliation with very minimal to no downtime to something a little bit more aggressive that's almost laser-like. So for patients who aren't good laser candidates, we can crank up the SaltFacial and give you a very similar result. So what I actually want to show you is I went ahead and I had already treated one side of Patty's face. So we can look at one side and it's nice and clear and smooth. We're gonna look at the other side. She's a little bit pink right here, but this is our treated side. So from her jawline up to half of her forehead here has all been treated, but she's not super red. She doesn't have any indication that she's had a really nice exfoliation. It just looks as it was when she first came in. So this little tiny bit of flushing will go down. That's totally normal. She even said, hey, my skin is reactive. Is it gonna develop welts or inflammation, anything like that? And the answer is no. So great treatment. Even if you have sensitive skin, you can get in a nice amount of exfoliation. So we're gonna start up our SaltFacial. The way that I explain how this works, this is the hand piece, and I'll explain before I turn it on because it's loud. The salt actually comes out through, and you can see it in here, the salt comes out through this bottom part of the hand piece. So what it does is there's these two tubes, one of them pushes the salt out, it sandblasts the skin. So you have this exfoliation of the salt, and it's completely self-contained, suctions it back out, and it's clean and gets rid of the dirty salt. So I'm gonna turn it on. Now we have it on the lowest setting, which is still very effective. Feels kind of scratchy, like a really light sandpaper. You can describe it. I feel like you'll be pretty creative with that. So we're gonna turn our head all the way to the side. I'll start working right here. So what we wanna do is keep the skin nice and tight and just glide across. So you can see in real time that we're laying down salt here. And in this entire area, we're getting exfoliation.
Yeah, it's like mildly uncomfortable, and you think it's scratching your skin up, but it's really not.
So this facial is pretty unique in that it's the only one that's using sea salt, and it has a really strong suction. So you can see I do this funny little technique where we lift up, kind of lift the heel part of this hand piece, and it's to release it from the skin. So everything stays in there. If I was to pull off, you'll actually see the sand shooting, or not the sand, the salt shooting out, and that's how you're getting the outer skin cells to exfoliate away. They're basically being brushed aside.
Yeah, it's kind of crazy.
It is. It's really cool.
Is it important to do it in little strokes like you're doing, or can you do long ones?
So you can do long ones. That's a great question. On her left side, it's kind of opposite my dominant hand, so I do shorter strokes to maintain really good control. On the other side, I have a really nice sense of kind of retracting the skin and going for longer strokes. So I do what's most comfortable for me. But you can do longer strokes as long as the skin is nice and tight. And I like to go kind of slow when I'm moving along the skin, but whether you're going slow or fast, Tracy actually says that you're still getting super, super effective treatments. So I tend to go in short little lines here. And I like to cross hatch in areas where there tend to be more lines. Feeling okay?
Yep.
Does the second pass feel funnier than the first?
No. Okay. I think I'm kind of getting used to it.
Yeah.
It's a little odd because it's like sandpaper kind of.
Mm-hmm. Yeah, it's definitely a little funny feeling.
How often do you have to get these done, Danielle?
I would say that this type of exfoliation is really best done monthly. But you know, depending on what's best for your schedule, you can space it out a little bit.
So pretty much this is part of every protocol that's done.
A lot of our patients are having the SaltFacial done. So
Right.
anytime we're doing a chemical peel, we're recommending SaltFacial because we want it's like sweeping before you mop the house. So you want to get rid of any of those big dust bunnies.
Yeah.
That's like our dead skin cells on that
Yeah.
surface layer.
Good to know.
And since this is a monthly treatment, what would you recommend just for maintenance in between it?
Good skincare. How do you talk to all about that?
Yeah, down in Restorsey.
Yeah, so good skincare. You know, what's really cool about Restorsey and the reason it pairs so nicely with this facial, I'm going to go over your top lip here. So the reason it's such a nice add-on is because this is a good facial for any skin type, any skin color, someone who is more sensitive, and you can actually use products from the Restorsey line that are retinol alternatives. So people who are pregnant or nursing or have very sensitive skin, we have products for that.
It is. And we're both natural and from the sea.
Mm-hmm. Yeah, that's a good point. Actually, I'm going to turn your head this way.
Okay.
So you can see that her cheek is not red. It's a little bit whitish looking because of all the salt that we've laid down, but I can just brush that away. And she's not super reactive, which is great. Last little bit here.
So you can do this on all skin tones and types?
You sure can. And this is good for any part of the body, which is something else I like to mention. You know, someone who has acne or pigmentation on their back, you can use this for. Anything, if someone had like textural changes on the arms, you can use this on any part of the body. It's just really good to prepare the skin, even if you're treating something like, as crazy as it sounds, like ringworm. You know, when you want your medications to really penetrate and seep into the skin that tend to be stubborn or hard to treat, you can use this so that everything is even more effective. All right, so we're pretty much good here.
Cool.
Yeah, I'm gonna do 2 more little strokes right in here. You know, so this is good. A lot of times we start to get these little frown lines right in here when we make our angry face. You don't even have any. She's never frowning, but sometimes we get frown lines here, crow's feet, and this is one other thing that we can do to really soften that because we're slowly sanding away at that surface layer of the skin. So that is SaltFacial. I'm done with that. Do you guys have any questions for myself or for Patty?
Would this help treatment of keloids?
Keloids are a little bit different of a case when it comes to scarring. This is a great extra step to add into the treatments, but as far as keloids go, you do need more aggressive measures. So sometimes they're steroids, sometimes they're more aggressive lasers. But as in between those more aggressive treatments, then absolutely doing a nice strong salt facial pass over that area could definitely be effective. That's a good one. All right.
Cool.
So I'm gonna wipe away the salt, but take another peek, guys. She's not swollen, she's not inflamed, everything looks really good.
So there's really no downtime for this, right?
Really no downtime. You know, we could set it to be a little bit more aggressive, and if we did that, then you would see more redness and more inflammation for a couple of days, but all in all, really good. So now anything that we put on your skin, whether we're trying for like anti-aging or brightening, it'll be so much stronger and work so much better. So we're gonna finish up our facial here, and then if you have any questions for either one of us, just send them in and we'll address them. Thanks for watching, everyone.
Thank you.
Thank you.
You're the best, Danielle.